respected Chancellor, Pro-Chancellor, and Vice-Chancellor, all the distinguished faculty, dear parents and dearest students, I am very happy to be here. When I was doing my undergraduation at Venkateswara College, I stay in Alderpet, and I used to pass through this road because our college was there in Nasratpet. So I have been witnessing this particular institution right from its scratch. First there was a temple that came up, and then one building, and from that today it's a great growth. I wish the management a very, very big congratulations for bringing in such a great institution with thousands of patients, as I just saw in the annual report, being served over 1 year. The footfall is phenomenal. Today, friends, as we are moving towards our 100 years of independence in the next 25 years, there is an imminent need today that we all really strive very hard to make medicine and related consumables, devices, implants, and other sort of treatment processes in the control of our nation. There is a need for us to reduce the imports, to reduce the dependency on foreign technology, and make a lot of things here within us so that we address one of the most important need for the country, need for every citizen, health care, with full confidence and full control. Today, what COVID has taught us, I repeat this example in every meeting or every convocation address that I have been delivering in the recent past. And being a medical institution, it's my duty to do it here too. When the West invented a vaccine and found that it was working at 8 degrees centigrade, they stopped further development because it suited their need. If we had depended upon that vaccine like what we had a century before, today this convocation would not have been possible. We as a country raised up to that expectation and not just developed one vaccine but 2 vaccines that will work at this humid, hot, at the same time cold, wet, different environmental condition of our country, delivered that vaccine to 140 crore people, not 1 or 2. And today, we are standing with confidence fighting this pandemic. Not only that, we exported, we donated this to the other needy country, and that is what makes Bharat a proud country. The recently concluded JEE exam, and when we look at the preferences of the top 1,000 people, they are the cream of our country. I did put this question, what made us, which discipline actually made us, to this state today? If you look at IIT Madras, the discipline that had enabled us today to come and talk with confidence is biological sciences. But if you look at the choice made by the students, biological sciences is the last choice. And that's a mutual contradiction in which we are. There are certain critical needs for our country, and we need to rise up to this occasion and work in those fields and really bring up our country to that stage. And that is all with youngsters like you who are graduating now. 25 years later, you may be the Vice Chancellor of this august organization. The whole country relies upon your contribution. And that is one very important convocation message that I want to deliver to all of you. Today, technology and medicine are coming together. I was very happy when the Ramachandra College, which is well known for the medicine, is opening up an engineering college also. It's very important today. If you look at many of the cause-effect relationship, for example, sugar causes diabetes, smoking causes cancer, drinking spoils the liver. All these cause-effect relationship has been found by engineers working closely with doctors, or engineers who know medicine, or medical doctors who know about engineering. So there is a very, very important intersection between engineering and medicine, and that is going to be very, very vital for us to specialize upon so that we take our country to the next stage of quality healthcare. If you look at the Nobel laureates, 37% of the Nobel laureates are physician scientists who have understood both medicine and engineering. I take this opportunity to request all the doctors, whether they are MBBS or dental or MS or other post-graduation, to have a sort of a deep introduction into understanding the engineering of the human body, to understand the engineering of the different devices that they are using, not just as a user, but to go and understand the deep principles based on which these devices work. When India was struggling for ventilators, we did come up with indigenous ventilators which solved the problem in the COVID times. And that required a strong interaction between engineering and medicine. One very important thing that is coming up today, with lot of data, as you see, as I came here a couple of weeks or 1 month before, every device today that is there in your ICU or in your other consultation, including OPD, there is a digitization that is involved there. Data is being collected. So there is lot of data that is available within our country. Our country is going to be the gold mine for health-related data. And we need to understand, as doctors, there is a need for you to understand this data, how to interpret that data, and how to make some reasonable conclusions which can guide you further in the healthcare of our country. So in this context, I also make this appeal to all the young doctors here who are going to graduate today, that you spend some time in understanding data science. You do some foundation course or some diploma or even a degree course in data science. The UGC, the University Grants Commission, has come out with, in my opinion, an historic order which says that you can do 2 degrees at the same time. For the current MBBS students who are in this college, can basically take up a data science diploma or a data science foundation course, either in the engineering college, or today there are many online resources that are available, and specialize in the area of data science. And that is going to be extremely important for you to make any further strong research in the area which the Western world today are following. But we have an unique advantage that we as a country sit on tons and tons of data generated on a daily basis. With the footfall that you see at Ramachandra, I think this is going to be a massive data collection and data massaging that you can do, which can really bring in a lot of state-of-the-art research and state-of-the-art development as a part of this entire medical and engineering journey. Friends, there is also an imminent need for developing certain policies for the country and quick dissipation of certain treatment protocols. Today, in the event of COVID, we did see other Indian schools of medicine, including Siddha, develop certain treatment processes which on an individual basis people found it extremely effective, but at the same time to get an international acceptance of this protocol and make it as a treatment process, there were a lot of hurdles and sometimes it has become impossible. The reason is that everything today needs a scientific basis, fortunately or unfortunately. When you say that this medicine should work, there needs to be a scientific basis. There are certain principles on which medicine as a theory has evolved. For example, randomized control trial. Right? When you look at randomized control trial, for a common man it looks absolutely idiotic. The simple reason is, we have, say, 3 different ways of treatment and we start doing a randomized control trial. On one wing or one arm we see very, very prominent results. But the remaining 2 arms, we are seeing that the patients are dying. But still the randomized control trial today imposes that we continue that treatment. Sometimes we find it against ethics. Right? To establish an Indian school of medicine treatment process in the international community, the acceptance is quite very, very meager, especially from the external world. And this scenario has to change. The Ayurveda, the Unani and the Siddha, as demonstrated today in the COVID era, addresses certain fundamental issues in our health, boost our immunity rather than treating a disease. It makes our body resist that disease. And these things have to be established scientifically, and I'm sure all of you doctors may take this as a side hobby, even as a hobby, to look at our Indian medical system and see how we can make a very, very sensible contribution from this end, specifically not only in terms of treatment process, but also we should start looking at publishing and patenting some of our earlier techniques. I am sure down the line, with the type of diseases that we are facing, type of pandemic that we faced, and new viruses and their variants coming up, the Indian School of Medicine, which tries to address the root of the problem by boosting our immunity, will have a bigger say in the global world. And for making it possible, it is all in the hands of you young doctors to take it forward. Last but not the least, I would also try to emphasize the point that we start looking very deeply into the medical devices. There are so many devices that we look, very simple ones, which are imported at a premier cost, unimaginable profit for the vendor, for the simple reason that they are qualified and they are working. When we actually look at the bill of materials of many of these devices or the equipments, it will be not even 1/50th of the cost that we pay. Your professors will certify that when there is no concept of negotiation when it comes to import. You just go and pay the price and get it. I think this is a very, very important point, which will make quality health care not accessible to our poor people. We need to democratize treatment process. And the way we can democratize is to provide this quality health care at a reasonable cost to the needy, to the poorest of the poor. And for this reason, we need to develop indigenous devices, and this requires a very, very, very close interaction between the engineering fraternity and the medical fraternity. Engineering and medicine have to come together And I request all the doctors to actually look for friends among your batchmates, etc., who have taken engineering and start at least debating on how to make devices. If you find a device in a particular laboratory, try to see what it means to make it in India. I think this thought process itself is extremely important so that we move forward as a country. And if all of you start thinking, at least we will try to replace 20% or 30% of the total annual imports that we do, both in the area of consumables and also devices and implants from the Western world and from the other parts of the world. As we approached 100 years of independence, we have got social independence in 1947 or political independence. We need technological independence. We need medical independence. And that is what will make our country very, very prosperous. And I'm sure all of you will put your great efforts in this direction and make our country a very, very highly healthy country with all quality, affordable health care to the poor and the poorest of the poor. With these very noble thoughts, I would like to thank your management of Ramachandra and all of you for inviting me to this convocation. It's a pleasure to meet you and hope we will all meet again in the medicine and technology interface. Thank you very much.